especially if you have a coexisting tidal hernia that may precipitate you to regurgitate. That should settle down. Typically, usually takes about 1.5 to 2 years to settle down. Once you start shedding the count, and let's say you lost 150 pounds, whatnot, all that is less pressure on the insides of your abdomen that is already causing the regurgitation. So the problem with regurgitation should really settle down as time goes by, but really it has to be looked in conjunction with what else is going on. Sometimes you develop or you have pre-existing esophageal motility disorders, so the esophagus itself doesn't contract well, may not have anything to do with the bariatric surgery itself, but the bariatric surgery unmasks the pre-existing problem. So that's again something to look into. With the bypass, usually we don't see regurgitation a lot, but if you are seeing regurgitation, a significant regurgitation after a gastric bypass, then you have to consider other things as to whether a pouch is larger than what it needs to be or a coexisting problem.
Thank you. Anybody want to come up to the mic? If you have a question, you're welcome to just walk up to it. Go back up.
Real quick, okay, is there a certain weight limit or amount of weight loss you have to have before you have the tummy tuck or anything like that?
No, there's no certain amount, but we do recommend you start complaining to your family doctor after you lose the weight and tell them that you do have the rashes, and because they have the documentation of this, so we can submit it to your insurance so they know that you do have a problem with the rashes and everything else. So that's very important to make sure you document it, because me saying to your insurance company you have problems is kind of a conflict of interest. So they're not going to let me look at my pictures, and we'll submit it with, to make sure that we have all the data that we need. But yeah, there's no real weight loss limit. I do want my patients though to be stable. The weight should be stable for at least 3 to 4 months, even 6 months before we decide to have the abdominoplasty or any other procedure. Because as you can imagine, if you're having the surgery and then you lose another 20 to 30 pounds, well, all that skin we just removed, all of a sudden now it's going to be loose again. You're not going to be very happy with me. That's why I make sure that you're all stable for at least 6 months, and then we can schedule the surgery. We want to maximize that surgery one time.
Just to add on to what Dr. Peter said, typically, because I have your medical history and your chart and I know what procedure was done, I'll have a sort of internal expectation or target for myself that I know that, as long as everything goes well, this patient should probably end up somewhere in this ballpark. I don't have a crystal ball, but I have a fair sense of where you're going to end up. Now let's say, just for argument's sake, 6 months after the procedure, you've seen people here who lost close to 100 pounds. And it may be very tempting to say, okay, I'm ready for plastic surgery. I have a big apron that's hanging off now and I would really like to get rid of it. However, if I think that the weight loss process has not yet, stabilized, like Dr. Peters was alluding to, I wouldn't recommend plastic surgery at that point, and I would rather advise you saying that, well, you have more weight coming off, wait till we kind of hit a plateau, and then I'll tell you when you're ready for plastic surgery. Typically, for most people, again, this is not one size fits all. Most people, that plateau usually happens at about 1.5 years after your initial bariatric surgical procedure.
Okay, go ahead with your question.
My question is the 6 to 12 months visits that you have to have with your primary care doctor, is it strictly just talking about that bariatric treatment that you want, or can it be incorporated into with other visits?
No, I can answer that. As far as the insurance piece of it, you can't have an ear infection and say, oh, by the way, let's talk about the fact that I want to have bariatric surgery and where my weight is and what exercise, because the insurance, that first diagnosis is what the insurance is gonna go by, and you came in for an ear infection. So when you schedule your appointments, you need to make sure that you are coming in for a discussion on your weight, so that's your number one diagnosis. And then your doctor should be talking to you about any foods that or like your diet, where your diet's at, if you're doing any exercise, those types of things. Now, if you want to add something secondary, they may let you do that, but that needs to be your number one diagnosis for the insurances to cover it and to count as the documentation towards the surgery itself. You can go ahead.
With me being 13 years post-surgery, I think one of the biggest things that I regret was the fact that I chose a surgeon down in Detroit. It wasn't very popular as, with medical doctors coming into this area, and it was, people you talk to, a lot of people were going to Detroit to have the surgery. And I was told by him that you're my patient for life. Do bariatric surgeons in this area take on other people's post patients?
These I can probably answer that.
Yes.
Yeah. Okay.
One, I would highly suggest that you come to our group support, and that was a handout at our table.
I got that.
We meet the first Tuesday of every month, and even if you decide that bariatric surgery isn't what you want to do, you are more than welcome at that meeting. It's a lot of fun. Travis over here, he can tell you, men and women both go to it. We have a great time. It's a way that you leave empowered. It's a great thing, but yes, we do. What you would have to do to switch over is to, one, request your records from your previous physician or surgeon, and then have them transferred to Dr. Stalin, and then he would want to see you, because he's probably going to want to do some tests to see what's going on, definitely lab work, that type of thing, and then it could be, and it definitely probably will be, you meeting with Megan, our dietitian, to see where you are there, so if there's anything we can treat on that side of things to get you back on track.
Yeah, because what I found is the support group, and the nutritionist down in Detroit, how often am I going to get there to do it? So when people think about having the surgery, I told Tammy, I said, this is the one thing that's so important, is that you know that you're this close to your doctor and your support group, because I really wish I would have had that. So
Thank you. Well, just so you guys know, I look like I know everything. I do. And you want to know why? Because I have this lovely little gadget, and I can text Dr. Stalin, and he's pretty good about responding. So you could ask me a question, and I answer, and you're thinking, gosh, Lisa's brilliant. And it's actually, I've got Dr. Stalin and my team behind me, and Megan's right next door, so I'll be like, could you hold just a minute? Megan! And I yell at her, and she comes over and answers the questions, but we have a great team and a great resource. We try to make it one phone call that you call, which is my number. And at some point I will have support in that, somebody else to help with that. But Megan is really good too. So if I'm not available, Megan knows pretty much everything that I do. And it's a good tag team, or Dr. Stalin's office. But one resource, one place to ask the question. It's usually, it's helpful so you're not calling everywhere. Do you want to go ahead with your question? You lovely lady with your jean skirt and everything.
Thank you. And first of all, I'd like to say thank you to all the people on this panel that has changed my life. I'm 11 months out, and I have had, it's not a problem, it's just something that has been brought to my attention, especially by my husband, that my voice has changed. And I wonder if that has anything to do with it. And the reason I'm asking too is because I had talked to a girl who, her father had the bariatric surgery, and he almost lost his voice, and they found that his thyroid had something to do with it. Is this something that I should pursue, or is it just going to get better?
So typically there are a lot of reasons that you can have a voice change after any surgery, not just bariatric surgery. But some of the main reasons would be, A, that certainly could have been some damage to the vocal cords right at the time of surgery itself, and the anesthesiologist puts a breathing tube in to breathe for you. It doesn't happen very often, but sometimes, yes, it can happen. And if you notice the change right from day one when you woke up, and that change has persisted, that's certainly something to look into, and which means the ENT physician has to look at it further to see what needs to be done. However, if this is something that developed after surgery, maybe after a gap of few months, whatever